Welcome to today's Explainer. We're going to unravel one of the most frustrating, kind of baffling mysteries of human biology. Why exactly do you have allergies? It's a fascinating question, really. Why does a perfectly healthy body suddenly decide to treat everyday, literally harmless things like a peanut, a cat, or a speck of dust as if they were mortal enemies? Today, we are taking a microscopic journey to find out exactly how and why our own bodies turn against us, and more importantly, what we can actually do about it. Okay, let's dive into this, because this is where the confusion usually starts, especially during those colder winter months when, absolutely everyone is sniffling. How many times have you asked yourself, am I coming down with a cold or are my allergies just acting up? Well, it turns out your body gives you some very specific clues to help solve this mystery. When you compare the common cold with allergies side by side, a few things jump out. Colds are caused by contagious viruses, right? Which is why they often come with body aches or sometimes a fever. But the absolutely crucial difference here is the timeline. Your immune system fights off a cold virus, and those symptoms usually resolve in a couple of weeks, max 14 days. Allergies, on the other hand, are an immune reaction to environmental triggers like dust mites or pet dander. Because of that, the onset is immediate upon contact, they bring itchy, watery eyes, and most importantly, allergies will linger for days to months, basically as long as that trigger is hanging around.
Section 1. The overzealous immune system. To understand why this happens, I want you to think of your immune system as a highly trained, well-meaning, but sometimes deeply confused security force. When you have an allergy, this security force isn't weakened. Actually, scratch that, it's totally overzealous. It all starts with this molecule, IgE, or immunoglobulin E. Normally, your immune system produces antibodies like IgA or IgG to fight off actual threats, like viruses. But in allergic individuals, certain harmless proteins stimulate the production of IgE. Think of these IgE antibodies as microscopic wanted posters. Your immune system prints them out, specifically profiling an innocent civilian, like pollen or a food protein, and falsely labeling it as a dangerous criminal.
Once these IG wanted posters are printed, they gotta be distributed, right? So they bind to the surface of mast cells. You can think of mast cells as your tissue's microscopic SWAT team. They are packed with storage granules filled with potent chemicals. When the IG antibodies coat the outside of a mast cell, they sensitize it. The SWAT team is now fully armed, finger on the trigger, just waiting for that harmless intruder to show up. And this brilliantly illustrates exactly what happens during a type 1 hypersensitivity reaction in real time. Step 1, you're exposed to the allergen. Step 2, your body produces those specific IgE wanted posters. Step 3, the IgE binds to the mast cell. Now, on a later re-exposure, the allergen directly cross-links with the IgE on the mast cell's surface. This triggers step 4, anaphylactic degranulation. Basically, the mast cell violently and explosively releases its granules right into the surrounding tissue. And what's inside those granules? A potent chemical cocktail, most notably histamine. Think of histamine as cellular tear gas. It triggers a bunch of chaotic reactions. It causes vasodilation, widening your blood vessels, which leads to redness. It increases permeability, meaning fluid leaks into tissues, causing that annoying swelling and runny nose. It causes smooth muscle spasms, which can make it really hard to breathe. And it calls in a swarm of white blood cells. This localized SWAT response is the actual biological reason you sneeze, swell, and itch. Section 2. When allergies turn deadly. Now, while a runny nose is super frustrating, allergies can quickly go from a localized annoyance to a systemic, full-blown emergency. And this quote highlights a highly surprising and honestly sobering demographic fact. While preschool kids have the highest rate of hospitalizations from food allergies, the greatest risk for a fatal reaction actually lies with teenagers and young adults up to age 30. This systemic, life-threatening reaction is what we call anaphylaxis. The timeline of severe type 1 hypersensitivity is absolutely critical to understand. Anaphylaxis features a rapid onset of systemic symptoms, often occurring within just minutes of exposure as those mast cells violently degranulate all at once all across the body. But the danger doesn't always pass immediately. Even if the initial reaction is treated, 4 to 12 hours later, a late-phase allergic reaction can begin, bringing coughing, wheezing, and swelling. And this late-phase response, it can stick around for 1 to 3 days because your body is synthesizing and releasing additional inflammatory mediators. Now, not all allergens are likely to cause anaphylaxis. The triggers most associated with this severe, rapid response are pretty specific. Peanuts and tree nuts are major culprits. Cow's milk is highly significant, particularly in young children.
Venom from insect stings is a classic environmental trigger, while drugs, like certain antibiotics or NSAIDs, are actually the most common cause of fatal anaphylaxis in the elderly. Because anaphylaxis causes your blood pressure to just plummet and your airway smooth muscles to spasm and restrict, popping an antihistamine simply isn't going to cut it. Adrenaline, also known as epinephrine, is the absolute first-line treatment. Administered intramuscularly, usually right in the thigh, adrenaline works instantly to increase coronary blood flow and relax those airway muscles, effectively pulling the body right out of that systemic shock. Section 3, testing, sensitization versus allergy. So, the crucial point is, how do we figure out what we're fighting before it turns into an emergency? Let's step out of the emergency room and into the clinic, where doctors essentially act as immunological detectives. They use two main investigative tools to figure out exactly what your body's SWAT team is reacting to. First, the skin prick test. This places a drop of allergen extract right on the skin, looking for a physical bump or wheal within 15 to 20 minutes. It's super fast, but you do have to stop taking antihistamines beforehand, and skin conditions can interfere. On the other hand, the IgE blood test takes a venous sample to an accredited lab to directly measure those specific IgE wanted posters in your blood. It takes a few days for results, but medications like antihistamines don't affect the accuracy at all. But here is where we need to firmly bust a very, very common myth. A positive result on either of those tests does not automatically mean you are allergic. No way. A positive test merely indicates sensitization, meaning your immune system has produced IgE antibodies, but you might actually eat or breathe that substance with zero physical symptoms. A true clinical allergy only exists if you have a positive test result plus actual physical symptoms upon exposure. This is exactly why a doctor interpreting your clinical history is just as important as the test itself. To make things even trickier for our medical detectives, our immune system can be easily fooled by something called cross-reactivity. IgE antibodies can confuse similar protein structures. For example, dust mites and shellfish both share a protein called tropomyosin. So your blood test might show a massive spike for a shellfish allergy simply because you're allergic to dust mites. If a doctor doesn't catch this, you might end up unnecessarily cutting out foods from your diet based on a total false positive. Section 4, managing the microscopic threat. So once we have a solid, accurate diagnosis, how do we fight back? Avoidance is always the best medicine. Here are some rapid-fire, practical room-by-room solutions for taking control of your environment. Dust mites thrive in warm bedding, so wash your sheets weekly in hot water, at least 130 degrees Fahrenheit. Invest in vacuums and air purifiers with HEPA filters to catch the smallest dander particles. Keep your home humidity under 50% to stop mold growth dead in its tracks. And if you're highly sensitive, replacing upholstered furniture with leather, wood, or metal removes the exact fabrics where indoor allergens just love to hide. Beyond medications and home proofing, there are also science-backed natural remedies that can help manage mild symptoms. Saline nasal irrigation physically flushes irritants right out of your sinuses. Studies have shown that vitamin C, particularly at high doses intravenously, can actually have a natural antihistamine effect. And bromelain, which is a digestive enzyme naturally found in pineapple, has been shown to reduce inflammatory swelling in respiratory pathways. It's pretty cool stuff. Section 5, training your immune system. Let's move to and see how this builds into the future of actually curing these conditions. What if we could tell the immune system SWAT team to just stand down permanently? This brings us to oral immunotherapy, or OIT. Instead of just managing our environment and hiding from allergens, doctors are now safely retraining the immune system. By administering highly controlled, very low-dose exposures to the exact food the patient is allergic to, they can slowly teach the body's immune cells to tolerate the protein. This builds what is clinically called sustained unresponsiveness. Now, what's really incredible is just how successful this retraining can be. Look at these sustained unresponsiveness rates after completing low-dose oral immunotherapy. 50% of patients with milk allergies achieve unresponsiveness. For egg allergies, it's 71%. And for peanuts, one of the most notoriously dangerous food allergens, a staggering 74% of patients were able to successfully retrain their immune systems to tolerate the allergens safely. That is an absolute game changer. Which leaves us with a truly exciting thought to close on. We've seen how a confused immune system can turn a microscopic protein into a systemic crisis. But we're also seeing the incredible potential of immunology to reverse that entire process.
Could we one day permanently retrain everyone's immune system to leave these harmless allergens alone completely? The science is moving incredibly fast, and a future without allergies might just be a whole lot closer than we think. Thank you so much for joining me for this explainer. Keep learning, and I'll catch you next time.